The call centre was going to be based in Gadham House and we couldn't do that, and then it's been virtual. I think it's been an amazing success that we have run something that's so accessible for carers that wasn't there before. There wasn't a single point of contact, there was lots of different places, and I think because of that we've reached far more carers through the pandemic and been able to support them.
Carers support has traditionally been very much about being in contact with people, being with people, meeting with people and supporting them face to face. So I think that's been the biggest challenge, and probably in overcoming that challenge has been the greatest success.
We come together in that kind of partnership to work with our key stakeholders, which is primarily Manchester City Council, Manchester Healthcare Commission and Manchester Foundation Trust.
I'm extremely proud of the way that the network has responded to the pandemic. The way that actually the challenges of the pandemic haven't overwhelmed us but have enabled us to carry on and to keep going forward and to deliver a new service.
And the work that we do to prevent social isolation and loneliness and improves people's mental health and well-being.
The helpline that we've created, the Carers Manchester contact point, that was one thing that carers told us they really wanted and needed, was to have one place to go for support.
And one of the things that we've been successful in doing is gaining funding to enable us to have carers on group breaks and things. And we've had to rethink how we've done that. But one of the things that's been a success for us as a forum is the establishment of our walking groups, where people have been able to get out and about with groups of friends in a safe environment, out of doors rather than indoors as they're used to being, and getting some fresh air, getting some exercise and actually meeting up with friends.
One of the things that we know as a result of COVID is that there has been a massive increase in awareness of how health inequality in particular leads to premature death. We know that there's parts of Manchester where people from diverse communities live. We know that those areas are often characterised by poor housing, poor employment prospects and the wider determinants of health.
It seems to have made a real impact for carers. Carers that have, we've asked for feedback, it's been really, really positive.
We've come together over the last 4 or 5 years, initially through the Carers Network, more recently in a much more strategic partnership through the Carers Partnership Group, and we've been able to demonstrate how engaging with organisations that engage with people really make a difference to the way in which services are delivered.
For people to recognise that they are a carer, they might just feel like they're doing their duty as a son, daughter, husband, partner. So we need to make people aware that actually, that if they need support, it is there.
I think the biggest standout success has been the way Manchester Carers has been able to establish and pull together the contact point right in the midst of the pandemic, bringing together a staff team, training that staff team, publicising the service, getting that service out to carers.
So in terms of the cultural aspect of the service that we provide, we say that it's important that people see people that look like them and understand them. So there is no barrier. So if there is a language issue, we will have somebody on our staff that is able to support you. There is a clear need for organisations like ours to be here supporting people within the community.
The evaluation that we've done of the delivery of the carer strategy has been really positive.
We actually deserve that level of support as the citizens of Manchester in order to make sure that the contribution we make continues.
We've such a diverse range of organisations, so we can provide support to carers from different communities, different backgrounds, for different, if you like, conditions of their cared for. And that's a really big strength.
I think we continue to develop the network, develop our partnership and reach out further into the community. Now that we're out of the pandemic restrictions, we can get back to face-to-face support to carers and use our skills and innovation to ensure that everybody, all carers out there, have an option of a local support service.
now that hopefully we're coming out of the pandemic and we're able to get out and about more, hopefully we can reach more carers in the community. We've got our locality partnerships, so we've got key organisations in North, South and Central Manchester who can now hopefully get out and about more and engage with people, like in supermarkets or doctor's surgeries, places like that.
Carers are the unsung heroes of adult social care.
I think I'm just proud of the whole of it because it shows the tenacity of the voluntary sector. I mean, we're 18 organisations from very small to quite large like Gadham working together to provide support for carers.